Pfizer's coronavirus vaccine now on the move in Europe, with the UK set to receive the first doses next week. Officials there urging patients amid an unprecedented public health mobilization effort.
It will inevitably take some months before all the most vulnerable are protected.
Here in the U.S., all eyes are on the FDA. The agency is still deciding whether to grant emergency use authorization to 2 vaccines. On December 10th, the public hearing will be held for Pfizer's vaccine. Moderna's is scheduled on the 17th.
They want to make sure that there's a certain amount of post-market data, safety data, on the people who've been vaccinated. And that's why the FDA process is moving a little bit more slowly than some of the other processes around the world.
If and when the FDA signs off, distribution could begin almost immediately. The Defense Department and HHS say the government is prepared to deliver several million doses to states within 24 hours.
And we are on track to be able to ship enough vaccine for 20 million Americans before the end of the year.
But many governors and state health officials warn that a lack of funding could slow the process down. New York's governor says vaccine distribution could cost his state nearly $1 billion.
The federal government is not providing any funding to speak of for the states to do the vaccinations. Who's supposed to pay for this? How am I supposed to do the distribution?
In other places, there are concerns about storage, especially with Pfizer's vaccine, which requires those subarctic temperatures.
There's only about 10 different hospitals in the entire state that have that capability.
Todd Willard's healthcare company in rural Kansas operates 2 hospitals, 7 clinics, and 2 nursing homes. None of his facilities can store the vaccine. Plus, he's worried about staffing during the vaccinations.
I've only got a certain limited number of staff. I've got to make sure that I've got enough that are taking care of all of the patients that we have, but at the same time, I've got to make sure that they're getting the vaccine.
With hospitalizations rapidly growing, it's a concern nationwide.
So many questions about logistics, but also safety, right, Steph?
Yeah, there are some outstanding questions, some big ones, actually. One of them is if vaccinated people can transmit the disease. There's also a question on whether or not the vaccine is safe for children or women who are pregnant or breastfeeding. All of those answers are going to come with more trials and more time.